Hi, What the HealthTech listeners. I'm your host this week, Hayley Levine. This is the podcast where we tackle some of the trending topics, ideas and best practice in health and social care. This week, I'm joined by Lee Davies and Lottie Moore, both from Public Policy Projects. So just a little bit about them. So Lee's worked in the world of healthcare and life sciences for over a decade. Long time, Lee. In this time, he ran the largest healthcare exhibition in the country and has since moved on to Public Policy Projects. I'm going to say PPP from now on because it's easier.
Absolutely fine.
Where he is looking to tackle some of the biggest issues in healthcare, environment, life sciences through better public policy. Lee's always had a passion for building meaningful partnerships and helping organisations drive better outcomes for people. Lottie has worked for PPP for several years and is particularly interested in social justice and health. She joined in January 2021 and has launched several reports on health inequalities since then. She also works for Professor Sir Michael Marmot at UCL, leading a network of businesses engaged in public health. Outside of work, Lee loves his music and sports. Big American football fan. What's your team?
Tampa Bay Buccaneers.
I'm a Chicago Bears. The only reason I'm a Chicago Bears is because I love Chicago and I watched it while I was there. So I'm
the
now
Windy
a fan.
City.
Yeah. It was freezing, absolutely freezing. Yeah. But Lee also has a passion for travelling and is keen to add to the list of countries he's been to. Lottie enjoys reading, socialising and running occasionally. Don't know why, I hate running. So welcome to What the HealthTech. Thank you for joining us.
Pleasure to be
here.
Yeah. Good, I'm glad you're here. So I want to talk a little bit about PPP, find out a bit more about what you guys do, the important work that you do and the impact that you have on the industry as well. So I'm going to come to you, Lee, first. So tell me a little bit about PPP. What's it all about?
So PPP, we've been going for about 25 years as an organisation. Our figurehead, kind of our leader, if you like, is the Right Honourable Stephen Durrell. The aim of the organisation really is to look at public policy and how we can, as an organisation, help shape the future of policy in specific areas. The main areas that we focus on are healthcare and social care, life sciences and the environment really. And I suppose the place that we play in the kind of the marketplace today is we convene people to tackle some of the toughest subjects to make sure that, we can produce policies, recommendations, outputs that enable, government, Department of Health, people, organisations, to do their job better, I suppose. And we aren't always the experts, but what we like to do is convene the experts and the people that know about the subjects where we're looking to tackle, to give them the platform and give them a voice to be able to help shape the future of public policy, really. So yeah, it's an ambitious aim as a business, but I think steadily and slowly we're starting to make inroads in some of the areas that we focus on as a business.
You said you tackle some of the difficult topics in health and social care. What sort of topics have you been through before? So
some of the issues ranging from women's health issues, things around abortion, contraception, in social care, how do we, that's one of the kind of, if you can fix that, one of the holy grails of policy right now. How do you give people lived experience, people within the communities that the government and we talk about, a voice to be able to say what's right for them. Integrated care, again, another holy grail of delivery from dating back probably when I was coming into health and social care. So for us, I mean those specific areas, and just off the top of my head, are areas that we're tackling. And again, you can't tackle it all at once, so you have to do it issue by issue and move the dial slowly and bit by bit, because you're not going to change these big systems and the way things have been done in these areas overnight, effectively. So that's probably what springs to mind immediately.
Yeah, it must be. I can imagine. Obviously, there's that many issues. There's obviously a lot of issues that the industry and the sector faces. How you say we have to tackle them one by one, because you can't do everything, can you? So how do you look at the issues and go, right, this is our priority and this is what we really need to change right now?
I mean, Lottie, do you want to take that one?
Well, I mean, the social care point is interesting. When Boris Johnson was elected, he said, his big maiden speech, I'm going to fix social care. Well, we're 2 years on and he was clearly busy doing other things like partying. But, that's a challenge, right? You know,
Yeah.
and that's a challenge for us, because how can we facilitate that? You know, there has been a social care crisis in this country for, you know, decades, and it's at breaking point. So there is a real demand right there for public policy, but it's urgent, right? And I think, again, so, you know, social care is one issue. Health inequalities, you know, for the first time last year, life expectancy is declining now in the UK, you know, in the first time in 100 years. So that's another urgent issue. And I think that's how you prioritise. And the pandemic is interesting because it has suddenly really, really then honed in on what the priorities need to be. Because before that point, you know, I don't think people necessarily were aware of what public health was, and that's a lot of what we do is kind of population health, public health. And I'd say, again, you know, the kind of integrated care stuff, you know, ICSs are being legislated for in July, but it's going to be years and years before that system is working properly. So again, how can PPP help convene the right people to make the right choices now that will therefore impact, you know, patients later down the line? So I think that's probably how we prioritise.
How difficult is it working with politicians and the government, but also balancing that you want to help, but you also need to keep in mind that the government does have priorities, and like, how does that work?
So we're independent, so we don't subscribe to any political agenda. And as Lee mentioned before, everything we do is evidence-based. So my feeling is that if everything you do is based on evidence and you have experts by, you know, experts through academia or experts through experience in a room, you can't go that far wrong in terms of policy, right? It, you know, I'm quite confident that the policy that we produce is more is stronger because it's evidence-based rather than subscribing to a particular ideology. I don't know whether you'd add to that in terms of how we work kind of in the wider sphere.
No, I agree, and I think, you know, in the space that we operate in, I think it is about, you know, developing policy that ultimately has, you know, better outcomes for people, for you know, getting a diagnosis for a disease, you know, better once you've been diagnosed, how do you find treatments, you know, if there isn't a cure, how do you manage those things when you come through the system. So I think, you know, our heart, I suppose, you know, as an organisation in the policy areas that we operate in is in the right place. So as Lottie said, is, you know, as long as we're convening the people, you know, that are impactful and matter to whatever area we're looking to talk about and, you know, create policy for, we're on the right track. And, you know, we'll probably touch on it in a bit, but, you know, that's how we look to find partners, you know, commercial partners, industry partners, you know, that almost see that value proposition and want to, you know, join a movement in terms of changing that policy and that landscape, because lots of the time, you know, you can't change policies without, you know, industry, you know, commercial businesses, you know, third sector, you know, the providers that, you know, that operate in the system. So we just operate in this middle ground space that looks to connect all these, you know, disparate organizations and groups that actually, when you bring them together, actually you find that there's some seriously, you know, strong common ground, and there isn't always a consensus, and you'll never get that. But the idea is to, you know, to find the strands that people can agree on, and how once agreed we can, you know, move forward, you know, better public policy, but ultimately just better delivery of care for you know, people and, you know, in society, predominantly obviously in the UK.
Yeah, I think we've been working with PPP for around 6 months now. So the whole of Radar Healthcare, lots of different people in our organisation have been getting involved in some of these groups, and what I've loved the most is how open and how non-judgmental these conversations are. So, you know, you've got forums where you can sit in and discuss the challenges, and you don't just have the industry, you have patients, you have people that look after patients. You have, I think I was sat on one and there was a parent of a patient, and it's just so good to be able to have an impact on those people with those stories. And, you know, we've loved kind of being involved in this so far, because I feel like we are able to kind of make an impact and influence some of those discussions and bring in our expertise as well. And I think it's just a really nice thing that you're doing.
Thank you.
So, welcome. So Lottie, policy analyst, what does a day look like for you?
Well, every day it's different, but that's a classic
in a good way.
answer, sure. A lot of what we do, so we, as well as health and social care, we work life sciences and also environment and the climate. So I think a lot of what we do is I suppose, kind of brainstorming as a group. There's a lot of kind of creativity. What did you read on the news this morning that made you think, oh, that that's a problem. What are we going to do? Well, how can we do something about that? Is there an appetite for that? And then I think as well, when you're actually delivering policy, you're creating these policies. So a lot of research. Writing stuff. I often I hold myself up in a coffee shop and put my out of office on, because at some point you've got to write the reports and produce the kind of outputs. So I think every day is different. There's a lot of networking. There's meeting people. There's we've been talking about convening, where how do you know you're convening the right people? You've got to go find them. You've got to talk to them. So I think there's networking, and it's a very, very a really sociable job.
That's good. That's what you want, isn't it? You don't want to be locked in a room on your own,
No.
just trying to figure out life.
We don't do that at PPP, just to be clear.
Yeah.
So coming back to the way you prioritise policies and kind of decide what the best approach is, for you, what does success look like? What's a good policy? How do you work through that?
It's a big question probably to answer. Do you want to start, and then I will take over when I formulate some thoughts.
I think you only start doing, we only take this stuff on because we do want to make a difference. But I think it would be wrong to assume that the government is the only audience that we want to influence. That's not true. For example, with our ICS Futures series that we're launching, we're bringing ICS leaders together because we want, ultimately they're the decision makers at the moment, or well, they will be. So how can we create discussions that impact the way that they work going forward? And ultimately then it's making a difference to people's lives. With health inequality, for example, which is, my kind of like super interest, is ultimately, it's not right that a baby born in Gateshead will live 15 years less than a baby born in Guildford. That's not okay. So I want to do something that ultimately reduces that statistic, which might seem idealistic, but you don't go into a kind of policy role. Policies, if they are right and good, they can change lives. And I think that's ultimately why I kind of get out of bed in the morning, what success looks like for me at PPP.
Yeah, and I think my background, I didn't come from the policy landscape, and my understanding and I've developed and formed my own ideas about what good policy looks like. And there are policies that are driven at government level, trying to pass legislation, but that takes a long time to be able to get those dials to move. But for me, there's just policy that, from an organisational perspective, what can organisations do, businesses do to enhance the lives and what people can, the health outcomes, I suppose. Our health inequalities work, we have a programme around what businesses can do, and that's not aimed at the NHS per se, but what can, businesses as anchor institutions, as employers, what can they look out for to make sure that their staff, their employees, that they're not suffering from health inequity, and how can they intervene as a business, as a kind of employer to help, the system, because actually if they could do that, the burden on social care, the burden on, the NHS will be reduced if we can change the role of the business and get businesses and, lots of businesses have, people and culture directors now, and that's the right route to go down, because if you can take care of your employees, they can actually go to a GP appointment, actually that, how can we create policy just within that framework to be able to, to help the outcomes of the people and the patients that, the NHS has to speak to and deal with.
There's so much that you guys can do, and there's just such a huge impact that you could have. But I can imagine it's such a big beast. Like, where do you go? Who do you talk to? How do you get the policies approved? What does the process look like for that?
Yeah, I mean, that's a really interesting question. There's not really a standard formula. Everything's very different depending on what the topic is and also what the time frame is. So I suppose we start right at the beginning. It's looking at from I suppose a wider societal perspective, is what's going on in the world. Is there a gap? Is there a niche that's not being filled that we could fill? And then I guess it's finding the appetite for that, commercially as well. Businesses that genuinely, care about the agenda and want to get involved. That's really important. And then I think, we start by then, looking and scoping and finding people, and then, as you've been on our roundtable sessions, bringing those people together in a virtual room or a physical room. But, that we were saying earlier, actually, how amazing that the sort of virtual world can be in terms of, we've got people dialing into most of our sessions like entirely internationally, which you just wouldn't have done 2 years ago, really. Yeah. And therefore the kind of scope of what you can do is much greater. And then I think, as I said earlier, there is the kind of collating all of that data into a document that is really, really clear. So ultimately, whoever you're trying to influence, whatever change we've found that is evidence-based and is right, the person doesn't have to do the work because we've already done it. Do you see what I mean? I think that's really key.
Yeah, and just to add, some policy areas are years away of changing, but some policy areas are so live, so we have to be quite reactive at points to, if we see, a piece of, something come through the news, we have to react, to it there and then, because actually, policy moves quite quickly in some, if the demand's there. And obviously COVID, I suppose, going back to March 2020, it moved the dials on so many different things, and obviously radar work in the health tech space, and now the adoption of technology, it exasperated the adoption of what once really sometimes hard to adopt products or services. And now actually policy moved quickly because there was a demand, there was a need, and there was no other option but to move with the way of the world. Whereas if that hadn't happened, we'd still be stuck in some of the older structures, systems, technologies that were still being used. But sometimes policy moves so fast because of an issue, a pandemic, that we as an organisation would track that and move along with that, because otherwise we wouldn't be a good policy institute if we didn't.
True. Do you find that a lot, where is kind of no other option and people have to uptake, it has to happen?
No, I think COVID was just it was a one-off,
Yeah.
I think the lessons learned will enable future programs, future technologies, future ways of working, delivering care to get better. And so the example will be different, but I think there's a real appetite now for people that actually change can happen. And now we have a test case of what a huge transformational piece, that transformed the way the entire world works. We were talking on the train up to today about Teams, and 2 years ago I just had a phone and a headset. Now all of my meetings, all of my telephone calls, aren't telephone calls. They're Teams meetings, they're Zooms meetings, they're Google Meets for the odd person that uses it. It's transformed the way we work, and I think that will only continue to change. But in healthcare, life sciences, it is a bit slower. But we just need to be the champions of the areas we work in, to make sure that we can continue to drive changes, however small those changes might be, along the way.
True. So, Partnerships Director, like I said, we have really enjoyed working with you guys so far. I think it has been a partnership. It's not been a one-way thing at all. What about other organisations like Radar Healthcare? How can they get involved? What's open to them? How can we make an impact?
I think for me, we have a list of areas. I'm not going to go into it today, but rare diseases, oncology, in life sciences, and social care and healthcare. I think if you have an ambition as a business to move agendas forward, ultimately a commercial business, there is a need to want to be in the room at some of these strategic conversations, but we kind of own the fact that actually you can't move forward without commercial intervention and commercial input, so if businesses have a desire to have strong, meaningful conversations, then we might not be aligned, there might not be areas we can collaborate on, but if there is, then let's have a conversation. And we have a list of things that we do, but that's not to say we wouldn't explore other areas should it make a difference and make sense to us as an organization and business, really. So just if you're in this space and you want to learn more, just get in touch, I suppose, is the message.
I think as well with that one, in terms of the value, we need businesses too, because they contribute something that is a much needed perspective. And I think particularly in terms of health and the work that I do, if 80% of people are employed in the private sector, it is foolish to think that it is only the responsibility of the public sector to look after that 80%. Businesses do have to be in the room. They do have a role. And I think particularly after COVID again, and in terms of health inequality, businesses are really waking up to that agenda now. And, like you said earlier, how can we look after the health and well-being of our employees? That's quite a new thing for businesses to be involved in. And I find it really exciting watching that.
And sorry, just to add, it's that, it's about job creation, wealth creation. The more wealth, the more jobs that are created, the less poverty there is. So for us, bringing that business voice to the table is essential, because it will only help, on the and support the systems that we have, predominantly here in the UK is where we operate. But that kind of piece for us is quite important, and it's kind of a common theme actually. You see, health inequalities. We have a program on it, but it weaves throughout the entire program of work that we have, whether we're talking about clinical trials or access to rare diseases, underserved populations. If we can create more jobs as a society, as a country, then that is the positive effects on healthcare and wellness and mental health, and all of it kind of comes as a part of that process. So that's kind of probably what I would add to that.
Yeah, and I think as well, Stephen, our chair, always says, if you give someone a friend, a home and a job, you will do more for their health than you will if you're a doctor in a white coat. In the, the social determinants of health is so important, and actually employment is one of those. A massive, good health is caused by good employment. People want to work in meaningful jobs. People don't want to sit at home all day. That stereotype, I don't believe is true at all. And so actually, people want to feel like they're making a meaningful contribution to society. And in turn, that affects their health, and that improves health outcomes. So, that's particularly the kind of health inequalities agenda, and where business is really important, is that businesses create those jobs, and those jobs do ultimately improve people's lives and improve people's health outcomes. So I think that's particularly within the health work that we do, where the role of business is so important.
We spoke to Big Ian. I don't know if you've heard of him.
Yeah, we've heard of Big Ian.
Big Ian. I
think the name speaks for itself, Lottie. Yeah.
I'd love to meet him.
He'll be at an event next week.
I'll just see him.
Big Ian. You can't miss him. There you go.
He's very tall.
If you're watching Big Ian, we'll see you next week.
Yeah, he used to be a bouncer as well. That's where he came from.
Okay.
So we spoke to him, and he said there are two types of people in the world: the helped and the helpers. And he said if you don't need to be helped, then you're naturally a helper. Because like you say, people don't want to not help. They want to have an impact. They want to help, and they want to know how to help. And sometimes even it's the smallest things. I think he said a quote that will always stick with me, and that was you can't help everyone, or something. You can't help the thousands, but you can make an impact on your street. And I think that's just so lovely, because you don't think, sometimes I think when you think about helping, it's like, I've got to do everything, I've got to give loads of money to charity, and I've got to stop my life to help people. But actually it's the small things, and it's the little impacts you can have. And like you say, just be a friend. You don't need to train to be a doctor and give your whole life to it. So
agreed.
Yeah, we should go and chat to him next week.
I look forward to meeting him.
Yeah, very interesting man. He does a lot of great stuff. So going back to kind of health and social care, why do you think public policy is so important for this industry?
Yeah.
I mean, I'll start and then I'll hand over to Lottie. I think it's so divisive. I think everyone, in their lifetime will need healthcare, whether that's seeing a GP, whether that's seeing a doctor, and then in the flip side is social care. Whether it's getting or going into a care home getting, care at home. I've had family members, on all sides of the system. So it's an area that just, it touches everyone at some point, even if it doesn't touch you at today or this point in time. So for me, it's that area that if you're never going to fix it, you're never going to please everyone. But what you can do is you can aim and you can set the right, framework to actually help deliver care across that spectrum. So for me, that's why we, have a focus on it. And I've, spent most of my very, short career in this space, because it is meaningful. Yes, it's a job and it pays the bills, but having conversations and being in rooms where people are trying to make a difference, it just enables us to have me personally, a bit more of a meaningful purpose to the work that I do. And you can hopefully see the passion in the work that we do and how we present ourselves as people, because it's if we can fix it, then mum, granddad, their lives might be a little bit more comfortable whenever they need the services that genuinely the NHS and social care can provide for them. So
I think the NHS is interesting as well, because a lot of our work is international, and I think the NHS has this sort of national unifying body. We see health in this country as a right. We have a right to good health. Internationally, that's just not the case. Health is a luxury, and that's why you need public policy, because until everyone has health and they see it as a right, not a luxury, then I don't think we'll ever be out of a job, because that's why you need public policy. And even within the UK,
Don't say that, Lottie. We might, if we fix social care, we might.
No. But within the UK, we need. Again, access is not equitable. So, that's why you need public policy. And that's what health is so important. People always say healthy societies are happy societies. And it's true, they intersect. And I think that's why it's important.
Yeah, definitely. Has there been any standout moments for both of you, for where you've done something, or you've been involved in a piece of work and you've seen the impact that it's made? Start with you, Lottie.
Yeah, so we've done a women's health project, and we were convening group, women and men, experts across the world to discuss. I think we were talking about contraception, and I really wanted to. We worked really hard to get women with lived experience, not just from the UK, but we actually had a medical student from Ghana on our call, and she joined the call, but she had her camera off, and she typed into the chat, "It's not safe for me to talk about this, so I'm here and I'm contributing, but I can only type." Wow. And that made me think, gosh, the scale of this problem is totally different in low middle income countries than it is here, and so that really kind of made me think, gosh, the reach of this work is big.
Yeah. Wow.
And me. And for me, I think, one of my colleagues, Anna, she runs a rare diseases program that looks to, it was almost an odyssey if you have a rare disease for some people and patients, to find, a diagnosis for what you have, and ultimately, obviously, rare diseases typically don't have cures. But what we've done as part of our work is create a patient group that sits alongside our industry colleagues, I suppose. And from that patient group, we've now connected parents, people that have rare diseases in their families, their sons, their daughters, and some of them have become friends and have been able to have this almost support group, through this experience of creating a better public policy for rare disease diagnosis effectively. So sometimes for us, that wasn't on purpose; it was by accident. But sometimes that has helped a few individuals actually have a support network for people to who are going through something similar and trying to navigate their way through what is an absolute minefield and challenge to comprehend, I suppose, because they just didn't have anywhere else to go. But we, in our convening power, I suppose. Just, and then we had a comment back from the team. Now we've become really good friends. So for us, and that's one thing. I've only been here. I've been here less than a year, but for me, that's a standout moment, because it's not just about the business, the organisations, the NHS, but what we're doing for for hopefully people who are we're trying to ultimately serve. So yeah, that's me.
How do those kind of situations make you feel when you see things like that, and when the press picks it up, and how do you feel? You must be proud.
Well, no, yeah. I mean, I think with women's health, I felt quite emotional, because a lot of the stuff that we're talking about, I could recognise in my own life. And with health inequalities, I come at life from a multiplicity of advantages. I'm white, I'm straight, I'm middle class. So I don't experience health inequality per se. With women's health, we were talking about situations where I thought, oh yeah, I've had that problem, and I haven't really considered that was ever a problem before. And I thought, gosh, yeah, my friends have been heckled when they've had to get an abortion by anti-abortion activists. And so when we produced that piece of work, I felt quite emotional, because I felt I was sort of very personally affected by it. And I hadn't had that before, particularly, because luckily I hadn't. But yeah.
Yeah, I think it's actually quite common, isn't it? I saw a woman on LinkedIn. She's a TV doctor, and she was talking about health inequalities for women and how women don't get the same kind of healthcare. And actually, I can't remember the exact percentage, but the percentage of women that can't get the answers that they need is significant. And you think about you're having a conversation around contraception. Women have to be the contraception, when you go to the doctors, it shouldn't be the case where women have to go through all of this, and it should be an equal thing. But, you as a partner should be able to have a discussion and say, who wants to take the contraception? It shouldn't, there's so many inequalities in it, it's not right.
There was a thing a few years ago. They produced a male pill, and it didn't get through clinical trials because it was too, it was considered too sort of damaging for the male to kind of go through this. The symptoms were too severe.
What about women?
I know, and I was like, well, if the pill had been introduced now, 60 years ago, it's revolutionary. But they tried to introduce it for men, and it didn't get through clinical trials because no disrespect. No. Because men found the symptoms too difficult. Oh. So again, it's.
But I think societally, I mean, it is. Obviously now I work in this space, so I get it. Yeah. But I think because society's been a certain way for so long, it's changing people's the way their brains operate, and how we're trained to think from a man and a woman's standpoint is tough. People don't like change, and obviously the status quo for women is obviously not good enough. It needs to improve, it needs to change, but obviously by and large, from a society perspective, obviously men aren't as a group probably not willing to make the change. And obviously I say that obviously you don't want to group people into the same category, but until you understand it, until you understand why, you can change the psychology behind it. It's pretty tough to adjust your mindset.
Yeah.
If you've this is how it's always been. That's just my view, and it's just it's a challenge. I think it's
no, definitely.
We are in 2022 though. Men need to sort it out.
Yeah. No, we step our games up.
It's internalised by women too. So I think actually a lot of female GPs that I spoke to were like, well, I didn't know that. I didn't know that wasn't that great. I've been prescribing it wrong for years. Actually, you don't need to do that check, or you don't need to, And so I think it is internalised by women as well. So I think gender roles you played by both.
Yeah. It's true. I think women feel, when you think about taboo subjects, I know we're going off topic, but it's interesting for our listeners. You think about these topics, and women feel nervous to bring things up, and a lot of the times, for a woman to go and buy a tampon, I send my boyfriend to go and get mine, and he doesn't mind. But a lot of men wouldn't do that because it's embarrassing, and then the woman feels embarrassed. And if you're at work and you have to mention it, it's embarrassing. And I think it's difficult. It's a difficult situation for both men and women to change their mindset that actually this is a normal thing.
Yeah.
All right, I'll get back on topic now.
No, okay.
That's great.
So going back to kind of the public policies that you work on. So are there any resources that people can get hold of, some of our listeners, if they want to find out about new policies or anything that you guys are working on, where can they look?
leave?
Yeah, I mean, just head to publicpolicyprojects.com, really. I mean, we have a library of, reports, policy documents that people can digest, look at, try and, get a couple of nuggets to take away back to their day jobs. And that's on everything from, say, healthcare, environment, life sciences. So yeah, just head on over to ppp.com, and yeah, you'll be able to hopefully find some tools and so on, and that can help.
Or you can listen to this podcast.
Or that is another alternative. There you go.
We'll be sharing it, don't worry. So finally, what's next on the agenda for you guys? What's coming up?
What's coming up? Gosh, I mean, we've got some exciting conferences.
Yeah, so we have a life sciences conference in November in Westminster. We have an environment conference in October that looks at some of the challenges around COP27. We've got a program starting in oncology in the community diagnostic space in June. We've got a clinical kind of research project. I mean, it's probably too much to go through today, but yeah, we're always busy. It's just constantly kind of just trying to just stay relevant, make sure that we're on the pulse when it comes to some of the challenges people, organisations, and sectors facing. Really.
Yeah. Can health and social care organisations or carers or doctors, nurses, can they just get in touch? And,
absolutely.
100%. Yeah,
we'd really love that.
Great. Well, what I'll do is anyone that's listening to the podcast, I will put some information in there for people to get in touch if you do want to raise an idea or a challenge or just something you want to get involved with, really. So thank you. We have one more question for you. So this is a bit of fun. We ask all of our guests that come on the show, what is your What the HealthTech moment? Now, what this means is tell me a weird and wonderful story that you've experienced in the health and social care world. Now, that could be something that's really, really strange, or it could just be something that's made an impact on your life and a really life-changing thing that's just a little bit different. So I'm going to come to you, Lee, first.
So mine's, it's a bit strange, but when I first downloaded the NHS app and I ordered my first repeat prescription using the app, you're able to see your history of prescriptions, not subscriptions. And I went back to obviously when I was a child and found the first ever prescription that I was given as a 4-year-old back in 1993. And it was obviously a drug I couldn't pronounce, couldn't say. But then I Googled it and it was for head lice. I can honestly say, all these years later, I am head lice free. But I found it's fascinating that, even 30 years on, obviously we sometimes say this, NHS structures, we haven't got the information, the data, but actually I, as a patient, just through logging on, found information on myself nearly 30 years prior.
It's crazy.
So for me, it's I don't work in the system. I can't confess to be a health tech expert, but it was for me. It was funny to see. So I immediately sent a screen grab and sent it to my brothers and said, we probably would have had it too, to be honest.
I think everyone has.
If you didn't have it when you were a child, you weren't living. That's
And what about you, Lottie?
So I only had one and I've used it in the Women's Health podcast. So I would just say I am a massive technophobe. So if there's any way I can avoid using technology, I will. So I'm not really deserving to be on this podcast. So that's probably my health tech moment, is that I just pick up the phone and I ring my GP rather than going on the app, because I never remember passwords for anything. So yeah, I'm sorry. Disappointing.
To be fair, I'm one of those terrible people that has the same password for everything because there's no way I would remember. But
this is a podcast, you probably shouldn't tell people.
Yeah, that's true, actually.
You might want to edit that bit out at the end.
No, that's great. Thank you so much for joining us today. So next week, we're going to be speaking to Rob Place and Mark Harrison. They work for Radar Healthcare, big advocates for partnership working. Rob supports our partners with training. He's our training manager. And Mark is one of our customer success managers, so I'm sure you'll have come across him at some point. Don't forget to rate and subscribe wherever you get your podcasts. And if you have any questions for our guests, for us, for Lee, for Lottie, then please email whatthehealthtech@radarhealthcare.com. Thank you.